really a funding mechanism, where an individual has a budget, we work with a fiscal intermediary, and they come up with a service package that's implemented. Self-direction is a very rich program. The budgets are substantial, and there's a lot of variation in terms of how resources are allocated, and also in terms of how people access self-direction or not. Self-direction in 2015 cost us about $100 million a year. In 2016 it was 200, in 2017 it was 300, in 2018 it was 400 million. So it's growing very quickly, 100 million a year. And because it's a program that includes budget authority, it's not something that we have much control over. And what that's done is it's created some inequity that we can't really explain. So we looked at ComHab spending, for example, to try to understand what the drivers for ComHab spending were. We spend about $440 million a year on ComHab. That supports 28,000 people with an average expenditure of about $15,000 per person per year. But we also know that it's not evenly distributed across those 28,000 folks. So we asked for that distribution. We found that 10% of the folks who receive ComHab receive 40% of the entire benefit, about $62,000 of ComHab per person per year. The other 90% receive about $10,000 per person per year. It's very much a disparity. And in one of the things that we've looked at trying to understand why that disparity exists, find that a lot of the folks in that 10th decile are participating in self-direction, where we don't have a lot of oversight because we've given folks budget authority and we don't have very much control. We've also gone back and looked at specific individuals in that decile and found that in some instances they're receiving 168 hours a week of ComHab. And 168 hours a week is 24/7, which means we're providing ComHab to some folks while they are sleeping, which to me is not consistent with the idea that ComHab is fundamentally a habilitative program for the purposes of acquiring skills. I know that we're using ComHab and ComHab funding to provide things other than habilitation. And it means that we need to look at self-direction a little bit more carefully because of its cost and its inability to ensure that we're delivering services that are effective and equitable. So it's a tool, it's valuable, but we have to look at that at some point.
But are you looking, because some of the questions seem to be aimed at accessing it even for those who are able is very difficult, and it doesn't apply well possibly to individuals with higher needs, and what's being looked at in terms of adjusting or redesigning that, I think was part of a lot of the questions.
I think we're going to look at self-direction, we're going to look at the scope of the budgets, we're going to look at budget authority, because we need to ensure that we have a system that is, accessible, equitable, and sustainable. As I described it, there's a significant growth in the program. As I've described it, there's significant variation in the program. And as I've also described it, there are instances in which we're paying for a service which I believe is not consistent with its purpose. So we will look at that, but that's part of a larger question of how do we ensure that we're putting the right services in the right place at the right time. So we're looking at what our relationship with primary care providers is, our relationship with mental health providers, what's our relationship, what kind of behavioral supports do we provide, how are they funded or not supported through family support councils, what's our crisis response program, what's our intensive respite program look like, how do we deal with ER and hospital stays and residential services. So we're looking at the entire continuum and the means that we currently use to fund it through vehicles like self-direction versus fee-for-service versus managed care.
And one of the questions, I hear a lot of analysis going on your part, but where is I started this whole off by saying, GROW tracks OPWDD. We literally began 6 years after you. And one of the big questions is where the role of families and family advocacy, because this entire system was not created because the state of New York suddenly felt munificent. It frankly came out of the Willowbrook settlement, frankly, OPWDD was set up because the Department of Health, frankly, always has been and never has apologized awful. And I could almost say killed our people, and I don't think that's an overstatement. And the issue is it's nice that you're looking at this, but we don't have any insight or input, and if we don't, you get the kind of reactions you're getting from the audience, which is, so where is the role? There once upon a time, at least, there pretended to be a role for families where we would sit on councils and raise these things. So, I mean, if you could describe, is there going to be that, or are we going to have to go to our legislators and ask for them to legislate some role of that type?
Excuse me?
Yeah.
That's a question.
Okay, but we'll let the commissioner answer first. Thank you.
Thanks. So we're looking at all of our advisory structures. We have some advisory committees that are identified in statute that require compliance with the Open Public Access standards. The DDAC is the main one in particular. We have reformatted that so that it's in a setting that's accessible to the public. That can be where we can invite people from that audience to make public comment. We also make the meeting available over the internet so that people can listen and participate. The minutes from that meeting are on our website so that people can see what was discussed. We are looking at our representation and membership on that committee to ensure that it reflects all of our constituents from the different geographies that we have, different racial, cultural, and ethnic groups, different economic groups, different disability advocates, so that we have a much broader representation. We're looking at opportunities to expand public input and participation, and that's something deliberate that we've undertaken, and there should be in the next 6 months announcements around the membership to our different advisory committees. So we're trying to be more responsive in that area.
Assemblyman.